Welcome back everyone to another episode of Logistically Speaking. Today we are diving into one of the most vital yet often overlooked pillars of modern medicine, that is healthcare logistics. It's an invisible engine behind patient care, the silent force ensuring that medications, equipment and essential supplies reach hospital, pharmacies and clinics exactly when and where they are needed. In healthcare, every second counts. Whether it's a life-saving vaccine, critical surgical tools or oxygen concentrators during a crisis, logistics can mean the difference between life and death. But have you ever wondered how this intricate system works behind the scenes? Or what's the future holds as we integrate new technologies, respond to global challenges and push towards a more sustainable model? Let's unpack all this in today's episode of Logistically Speaking, because this isn't just medical supply chain, this is a lifeline of healthcare. The healthcare supply chain is an enormous ecosystem. It spans pharmaceutical manufacturers, massive distribution centers, transport providers and thousands of frontline healthcare facilities. And it's growing fast. As per reports, the global healthcare logistics market was valued at $185 billion and is expected to grow at a CAGR of 8%, reaching $290 billion by 2030. This momentum isn't by chance. It's being driven by two powerhouse systems, cold chain logistics and just-in-time delivery. Let me break it down to you. Cold chain logistics is absolutely essential for temperature-sensitive pharmaceutical like vaccine and biologics. Think back to the COVID-19 vaccine rollout. Some of those doses needed to be stored at minus 70 degrees Celsius. Without sophisticated cold chain infrastructure, that global operation simply wouldn't have happened. Cold chain is what ensures efficacy, integrity and reach across borders, climates and conditions. Even in sea movement, over a period of time, almost all the pharmaceutical movement is being turned to reefer container movement as the quality consciousness is increasing. This, coupled with just-in-time delivery, is a game changer for hospitals. Instead of overstocking, hospitals are increasingly relying on precise, demand-driven supply chain models. Surgical tools, medication, IV fluids, they arrive when they are required and not before. That reduces waste, saves space and improves patient care. We are seeing a healthcare system that's becoming leaner, smarter and more responsive. Together, these logistic innovations are transforming the industry into one that is resilient, efficient and ready for the future. Well, at the same time, the healthcare logistics landscape has its fair share of obstacles. Let me talk on 6 of the major challenges which have real-world consequences for patients. First, the supply chain disruptions. We have seen how natural disasters, pandemics and geopolitical tensions can rattle even the most robust system. For example, the hurricane in Puerto Rico named Maria in 2017 devastated IV fluid production in Puerto Rico, which resulted in US hospital struggling for IV fluid since 50% of US demand is met by the production of IV fluids in Puerto Rico. Even in one region, and the ripple effect is massive in many other countries. This shows why we need diversified, decentralized supply network that doesn't collapse when a single link breaks. Then there is cost and waste. The US healthcare system wastes an estimated $25.4 billion every year just from supply chain inefficiencies, according to some analysis. This results from expired stock, over-ordering and poor inventory management. That's not just money, that's missed opportunities to save lives. Number 3, temperature control and cold chain failures. Many drugs like vaccine, insulin all require specific temperatures at 2 degree or minus 20 degrees Celsius. This at times is a challenge due to power failures, last mile delivery failure or refrigeration problem in transit. All these result in losing billions lost annually. Number 4, regulators and compliance hurdles. Different countries have multiple regulations, custom regulations, or complex documentation which result in delays and losses. Number 5. Last mile delivery challenges. Getting the medicine to rural areas, especially in the case of developing countries, is a big challenge due to the poor infrastructure available. And finally, one of the most alarming threats, that is counterfeit drugs. According to the World Health Organization, 1 in 10 medical products in developing countries is fake. This is not just illegal, it is deadly. So the big question here is, what's the future of healthcare logistics? Technology is fundamentally reshaping the way we approach healthcare logistics, making it not just faster and more efficient, but smarter, more secure, and more responsive to the dynamic needs of modern medicine. As global demand for medical supplies continue to rise, innovation has moved from being a competitive advantage to a core necessity. From artificial intelligence to autonomous delivery and blockchain verification, we are no longer simply delivering care on time, we are working ahead of time. Let's begin with one of the most transformative developments in our space: AI and predictive analytics. Gone are the days of reacting to shortages and scrambling to replenish stock. Today, artificial intelligence allows us to forecast demand with a remarkable accuracy. These systems analyze everything from seasonal illness trends to regional demographic data and even global health alerts that help in smarter stock management, reducing both overstock and waste. In hospitals, tools like tele-tracking software are revolutionizing resource allocation, streamlining bed management, improving patient flow, and ensuring that staff, equipment, and medicine are exactly where they need to be, especially in critical care departments. Equally game-changing are the advances in drones and autonomous vehicles, which are transforming the very concept of medical delivery. In countries like UK and Rwanda, drones are already in use to transport blood samples, slashing transport time from 30 minutes to just 2 and moving vital medical supplies to remote hospital in under half an hour, a development that is saving lives in real time. Drones and autonomous vehicles are no longer in the drawing board but are real world systems already in many countries, which help in speed, accuracy, and temperature controlled movements. Then we have the blockchain, the new backbone of trust in the pharmaceutical supply chain. It's becoming a critical tool in the fight against counterfeit drugs. By creating a secure, tamper-proof digital ledger, blockchain ensures every step from manufacturer to end user is transparent and verified. But innovation isn't just about addressing today's problem. It's about anticipating tomorrow's challenges. That's why AI-powered forecasting will be at the heart of next-generation healthcare logistics. Imagine a future where hospitals have live, real-time insight into inventory, where there are no unexpected shortages and no stockpiles of expired medication. Predictive AI will help manufacturers and providers plan ahead with confidence, enabling just-in-time inventory systems that are agile, cost-effective, and prepared for demand surges before they happen. This is not just reactive logistics, this is proactive, precision-driven care. At the same time, the rise of telemedicine and home healthcare is shifting the center of gravity away from hospital and towards the patient. Care is moving closer to where people live, and that means the supply chain must follow. Logistic providers will need to build direct-to-patient networks that are fast, flexible, and built to handle sensitive pharmaceutical with a cold chain integrity. We are no longer talking about logistics that end at the hospital door. The future of logistics is building systems that go all the way to the patient's doorstep safely, reliably, and on time. As global demand for healthcare continues to rise, logistics will remain the backbone of timely, effective, and life-saving care. With AI streamlining operations, drones reaching remote corners of the world, and blockchain securing every step of the supply chain, we are not just witnessing improvements, we are shaping a smarter, more resilient and patient-first future. Innovation in healthcare logistics isn't just about efficiency, it's about impact. It's about saving lives one delivery at a time. Thank you for tuning in. Until next time, stay curious, stay informed, and keep moving forward.